Hi, my name is Anna, and this is Jasmine.
Hi.
Today we're going to be talking to you about trauma-focused cognitive behavior therapy. Trauma-focused cognitive behavior therapy is based on principles of cognitive behavior therapy and trauma treatment. Trauma-focused cognitive behavior therapy was developed by Drs. Judy Cohen, Esther Deblinger, and Anthony Manarino, who worked together to conduct treatment outcome studies for sexually abused and otherwise traumatized children. This treatment model was initially developed to address trauma associated with child sexual abuse, but it has more recently been adapted for use with children who have experienced a wide array of trauma experiences, including multiple traumas. The therapy has developed to resolve post-traumatic stress disorder and depressive and anxiety symptoms, as well as to address underlying distortions about self-blame, safety, the trustworthy of others, and the world.
TFCBT is a short-term treatment that may work in as few as 12 treatment sessions. Treatment may be provided for longer periods depending on the child and family's needs. Individual sessions for the child and for the parents, as well as joint parent-child sessions, address the following: providing education to children and their caregivers about the impact of trauma on children and common childhood reactions to trauma. Helping children and parents identify and cope with a range of emotions. Developing personalized stress management skills for children and parents. Teaching children and parents how to recognize connections between thoughts, feelings, and behavior. Encouraging children to share their traumatic experiences, either verbally, in the written form narrative, or in some other developmentally appropriate manner. Helping children and parents talk with each other about the traumatic experiences. Modifying children's and parents' inaccurate or unhelpful trauma-related thoughts, and helping parents develop skills for optimizing their children's emotional and behavioral adjustments.
Evidence is growing that trauma-focused cognitive behavior therapy is an effective treatment for sexually abused children, including those who have experienced multiple other traumatic events. Research indicates that trauma-focused cognitive behavior therapy is effective in treating post-traumatic stress disorder, depression, and behavior problems, including sexual behavior problems in children exposed to traumatic events. There is strong scientific evidence that trauma-focused cognitive behavior therapy helps children, adolescents, and their parents overcome many of the difficulties associated with abuse and trauma, such as multiple randomized controlled clinical trials by different research groups have found that trauma-focused cognitive behavior therapy is better than no treatment or good comparison treatments in reducing common symptoms related to trauma. This is the highest level of evidence for treatment efficacy. Trauma-focused cognitive behavior therapy was given a ranking of 1, the highest level of empirical support in the U.S. Department of Justice sponsored report, Child Physical and Sexual Abuse, Guidelines for Treatment. Trauma-focused cognitive behavior therapy was selected as best practice for cases of child abuse in the Kaufman Best Practices Final Report, sponsored by the National Child Traumatic Stress Network. And trauma-focused cognitive behavior therapy has been named a model program by the National Registry of Evidence-Based Programs and Practices of the Substance Abuse and Mental Health Services Administration.
One of the strategies from TFCBT is stress management, which involves techniques for helping children control their feelings. One of these techniques is called controlled breathing. Controlled breathing is a useful procedure to help children and adults manage anxiety and stress. It's usually taught to help children cope with stressful thoughts and situations that are likely to occur as treatment progresses. The goal of this procedure is to have the child focus on their breathing and ensure that they breathe deeply and slowly. Breathing in this manner tends to inspire physiological relaxation. Therapists begin by instructing the child in the technique and demonstrating appropriate deep breathing techniques in the age-appropriate way. Children practice the skill in a therapy session under the supportive supervision of the therapist. They're also given homework to practice their breathing technique at home. Controlled breathing teaches several important lessons. First, children learn that they can control some of their body's automatic functions. Second, they learn that they can eliminate or reduce feeling of tension and anxiety. And finally, they learn that by concentrating on their breathing patterns, they can distract themselves from unpleasant thoughts or images. I hope that this video has been helpful, and we thank you for your time. Goodbye.
Bye.